Hey guys, in this week's video we are looking at fungal nail infections, and in particular we're looking at the best fungal nail treatment and basically the most effective way of treating a fungal nail infection. This is the video for you if you currently have a fungal nail infection, so keep on watching. So before we begin, this is going to be quite a long video full of information on how to treat a fungal nail infection. So if at any point you want to find a specific piece of information, feel free to click on the description below. It's all chaptered. You can find what you want. Also, if at any point you find the information in this video helpful, please click that like button because it's really going to help me and it's also really going to help the video grow. So let's begin with the basics. How can you tell if you have a fungal nail infection? It's pretty simple. Everyone says your nail will be discolored, but what does discoloration mean? So these are normal nail colors that we all know, but a discolored nail usually starts as a yellow color. It can then turn white, it can also turn a greeny color, and it can potentially then turn black. So fungal nail infections can have all spectrums of colors, but that's what we mean by discoloration. So a different color to the normal color that we expect nails to be when they're nice and healthy. Now, whilst we're on the topic of the nail color, I also want to make you aware of something really important that we need to spread more information on. That is, if you ever notice a black vertical line running through the nail, so it's a very particular type of line just vertically running through the nail, this can sometimes be a sign of cancer. So if you ever notice this, if you have one currently, you need to speak to a healthcare professional. This is super important and it's one of the main things I want you to remember and spread to other people from this video. Now, with a regular fungal nail infection, the discoloration usually starts at the top of the nail, then it works its way down. It can then move on to the skin. It can make the skin around it red and inflamed, and also sometimes it can then spread to other toes, other nails. This can happen as well. And along with all this discoloration and change around the nail, you might also notice that nail becomes more brittle, it's breaking easier, it's flaking off kind of, and it can sometimes distort the shape of the nail as well. So these are all the kinds of symptoms to be aware of. Now, fungal nails aren't particularly painful. It's not really a condition that's associated with pain, but sometimes they can become painful, especially when they start to peel away and show the cuticle. Also, for example, if you're wearing shoes and it's starting to lift the nail and it's pressing down on it, this can sometimes cause a lot of pain, but generally speaking, you don't usually get pain with this condition. Now, fungal nail infections are more common in toenails than fingernails, in men rather than women, and in older people rather than children, but they can affect anyone of any age. You're also more likely to get them if you have damaged nails, for example, through regular nail biting, have psoriasis, diabetes, peripheral artery disease, or a weakened immune system. But please do not fear, I'm going to be going through the best fungal nail treatments for you. So the next question is, how do we treat a fungal nail infection? What is the most effective way of treating a fungal nail infection? Well, first of all, before we move into that, some patients choose not to treat a fungal nail infection, and this is completely okay as long as you speak to your healthcare professional about it. You might be thinking to yourself, well, I'm okay with it, it's not causing me any problems, so I don't really want to treat it. But I imagine you're watching this video because you want to do something about it. But I just wanted to make everyone aware that you don't have to technically treat a fungal nail infection, but please do remember, if you don't treat it, it's not going to go away on its own. It's not something that's just going to go away on its own if you don't do anything with it, and it could potentially spread to other nails as well and other parts of the body as well, potentially. So it's super important, if you don't want to treat a fungal nail infection, that you speak to your healthcare professional, just so you can make them aware of what's going on, because they might say to you, actually, you need to treat it. So run it by your healthcare professional. Now, moving on to fungal nail infection treatment. What is the best treatment? I think the best way that I can present this to you is to go through each treatment option and describe how it works. So the first treatment option is a nail lacquer known as Amoral Fine 5%. So you apply this on the nail. It's not suitable for everyone, however. You have to be over 18, and it's not suitable for pregnant women either. In the UK, you can buy this over the counter, but the thing about Amoral Fine is it can take quite a while to see results, and you need to be really strict with it and use it properly and use the file that comes with it and do all the things that you're instructed to in the pack as well. So it can be a bit difficult to do, but if you use it for long enough and you stick to it and you're strict with it, it can be really effective at treating the fungal nail infection. Now, Amoral Fine lacquer is applied to the affected nails once or twice a week after filing, and it's best to avoid false nails or nail varnish during treatment. If you feel like you can't avoid wearing cosmetic varnish, this should only be used when needed and applied at least 10 minutes after the Amoral Fine, and always completely completely remove it before any filing or your next Immoral Fine application. Now, an alternative to antifungal lacquer is using a special nail softener to soften the nail and then scrape the infection away until healthy new nail can grow from the base. This method doesn't treat the nail infection, but physically removes it. Now, one of the main benefits of nail softeners is, first of all, the ingredients aren't very harsh, so you can use them quite often. The ingredients are usually urea-based or lanolin-based, so you can use them quite often and more people can use them, so there's not a big list of people that can't use them. Also, one of the other main benefits is you're going to see results really quickly with it, possibly within 1 to 2 weeks if you're doing it properly. Now, compare that to a Immoral Fine, which we're talking 6 to 12 months to see the real benefits. Now, I know what you're thinking. You're probably now thinking, well, what's the downside of these? Well, the downside is, first of all, if you're diabetic, you can't use a nail softener. Also, remember, it's not treating the fungal infection, you're just scraping it off. So after you've finished with it, you need to then apply an antifungal cream for a couple of weeks, maybe even up to 4 weeks, to try and prevent it from coming back again. Now, moving on to the next treatment options. The first two that I've told you so far have been over-the-counter ones that you can get from any chemist. Now, if they're not working, if you're not seeing any results, then you're gonna go and have to speak to your healthcare professional, your GP, advanced clinical practitioners like myself. We'll speak to you then. When you speak to one of us, we're gonna take a nail sample. We're gonna take a biopsy and send it to the lab to find out exactly what is causing it. Now, once we've done the biopsy and we sent it to the lab, sometimes we have to repeat them as well because sometimes they're not able to find out what's causing it. So you might need repeat biopsies as well. But once we've got the results in, it's gonna help us make an informed decision as to, one, what's actually causing it. Is it fungal? Is it something else that's causing it? And then we're gonna be able to make that informed decision and prescribe treatment for it. Now, let's say the results come back to me and it's a fungal infections. One of my favorite treatments is a tablet that I prescribe, usually terbinafine tablets. There's also itraconazole tablets. Both of these are antifungal tablets that can be prescribed. You can't buy them over the counter, they must be prescribed. And also remember, they can be very harsh on the liver. So when you're on this medication, we're going to be sending you for routine blood tests every month to make sure that your liver is okay, because sometimes it can really damage the liver. That's why we need to monitor it routinely. Now, one of the good things about these tablets is they're going to work far faster than the lacquer is at killing this fungus. Usually you start to see results in about 1 to 3 months, okay, and treatment with terbinafine can last up to 6 months as well. So bear this in mind, but always do speak to your healthcare professional so they can make sure you're safe and suitable to take any medication. Now, let's say, for example, you've tried the over-the-counter treatment, the Immoral Fine, the nail softeners, they haven't worked, and then you've been prescribed an antifungal tablet and that hasn't worked. Then the next option potentially that your healthcare professional can go down is actually physically removing that nail. Now, it can be relatively painful, but it's one of the most effective ways of treating a fungal nail infection, okay? But a lot of patients don't want to go down that route, but sometimes when you've gone through all the options, that's the only one left. It's not that painful as well. I know I said it is painful, but they numb it, so you won't feel much, okay, when it happens, but the recovery time can vary. It can take up to 4 to 12 weeks, and it can take up to 18 months for that nail to regrow as well, so bear that in mind as well. But like I said, always do speak to your healthcare professional about these for more information. Okay, so now that we know all about the best treatment options for fungal nail infections and what are the most effective treatments for fungal nail infections, the next thing that I want to discuss with you is preventing a fungal nail infection in the first place. Now, before we move on to that, if you found any of this information helpful so far, I would really appreciate it if you click that like button just to show that you've learned something new or you found this video interesting, and it's going to help me, but most importantly, it's going to help the video grow so more people can see it too and learn from it as well. Now, the next thing I want to tell you is the nails grow very slowly. On the toenails, for example, they grow about 1 centimeter every 3 to 4 weeks. So you need to bear this in mind. That's one of the reasons why it takes so long to treat a fungal nail infection. But it's also important to remember when we're talking about preventative tips. So tip number 1, you need to keep your feet clean and dry as often as you can. When you wash your feet, make sure you're going in between the toes, wash all over it. But then the most important step afterwards is make sure you're drying it thoroughly with a clean towel. Don't keep reusing that towel on the foot or on your hands or on your body. When you've used the towel, you need to put it in the wash so it can be washed. So you're using a new towel every time, and make sure you're drying in between the toes nicely so there's no damp, there's no moisture there, because fungus loves moist environments, it loves warm environments and dark environments. But when you think about your foot, it's pretty much got all three of them. So you need to keep it nice and dry. Another tip as well is to get the hairdryer as well afterwards. I like to do this, obviously not on the super hot setting, on the cold setting or on the medium hot setting, so you're not burning yourself, but get in there nicely in between the toes and nicely dry all over the foot. Moving on to tip number 2, you need to make sure that you're not wearing tight, constricting shoes. All this is going to do is increase that moisture, increase the heat in the shoes, and cause you to sweat more, and again, create that environment for the fungus to grow. So what do you need to do? You need to get some new shoes if they're too tight, and also make sure that you're not wearing synthetic socks. Instead, go for natural ingredients, not ingredients, but natural materials like cotton. It's much more breathable, your feet can breathe, and also make sure you're changing your socks at a minimum daily, okay? If you've got really sweaty feet, you can do it twice a day. Some people do that, it's quite normal, but if you at a minimum, change your socks, brand new socks, once a day. Moving on to tip number 3. When it comes to shoes, trainers can be particularly bad culprits for contributing to fungal nail infections. Try not to wear them for long periods of time and alternate between at least 2 pairs if you're using the same ones every day. Look for ones with ventilation holes as part of the design, and loosen the laces when you're storing them so they can aerate properly and get nice and dry. And whilst we're on the topic of shoes, make sure that you're avoiding tight shoes, because that's a really good way to prevent fungal nail infections. Instead, choose shoes that have a wide toe box. Some of them state that as well on the shops now or on the websites when you're about to buy them, and that allows good circulation as part of the design. You should also throw out any old footwear that is too worn and damp. Moving on to tip number 4, I'm sure this one we've all done at one point in our lives. When you're going anywhere public where you have to take your shoes off and you have to go barefoot, like swimming pools, public baths, wherever you go, sauna, anything like that, in the gym changing rooms, all these places, make sure you're not walking around barefoot. Make sure you've got some flip-flops so you're not spreading anything to other people, but most importantly, you're not catching anything from other people as well. So flip-flops are a must. Make sure they're in your gym bag all the time. If you forgot them, just don't do it, okay? If you forgot them, go home and get them, okay? Or leave them in your car always so you can always remember it, or just leave them in your bag all the time so that you can always remember to bring them. Now, tip number 5 is all about personal hygiene, and it's making sure you're not sharing personal equipment. For example, towels, for example, razors, tweezers, clippers, all these sort of things you shouldn't be sharing with other people. That's your stuff, you look after it, you keep it clean, don't share it with other people, because remember, fungal nail infections are contagious. So if someone else has got it and you're using theirs as well, it's just going to spread to you or vice versa. And lastly, tip number 6, remember that fungal nail infections can sometimes result from athlete's foot. An athlete's foot is again a fungal infection that usually happens between the toes. Now I do have a video all about this as well, so if you want more information on treating athlete's foot and preventative tips on that as well, I will leave links up here and in the description below. I would highly recommend you watch it because we want to keep the feet nice and fungal free. So the next question is, when should you seek medical advice for a fungal nail infection? Well, the first thing is you should always speak to a healthcare professional if you have a fungal nail infection. This is really important to make them aware so they can give you the best advice on what to do next. However, there are particular circumstances as well where it's even more important that you seek medical attention. So for example, if you're diabetic or you've got any immunosuppression, 100% you need to speak to your healthcare professional about it, because you're at much higher risk of complications and things going wrong. Also, if you've got any pain, if it's red, if there's any pus coming out, this can sometimes be a sign of an infection, which again, you need to speak to your healthcare professional about. These are the main things that you need to remember, but I will put more information in the description below as well. And I nearly forgot to mention this again, don't forget the vertical dark line that runs through the nail. If you ever notice this, a vertical line running through the nail, okay, this can be a risk of cancer. It could potentially be cancer. So it's really important you remember it, and that you remember it if you see it on other people. You know, you could see, I don't know, you could be in the train and someone's holding the pole and you can see their finger, they've got a black line running through it. Mention it to them, okay? These are things that we can do as human beings to look out for each other and spread the love to each other, because it's important that we look out for each other. So it looks like we've come to the end of this week's video. Like I said, if you found any of this information helpful, do click that like button. I'd really appreciate it, and it's going to help the video grow, which is the most important thing, so more people can learn about the best fungal nail treatments, about the most effective way of treating a fungal nail infection, and knowing what to do, when to seek medical attention, and knowing everything about it. Thank you for watching. Always remember you're awesome, and always remember, I'll see you next week. Remember, if you ever have a... Okay, Okay, so now that we've looked at the best fungal nail so now that we've looked at the best fungal nail infection treatments out, did you know that when we're talking about fungal nail infections, so tell your friends, tell your family, tell your loved ones, tell everyone, tell your neighbor, tell your dog, I don't know. We've all done it before. You've gone to the changing room and you've forgotten your flip-flops and it's complete horror. You know what I mean. You've forgot your flip-flops and you've gone to the changing room after you finish and you're like, oh my god, I can't even get a shower now, I'm gonna have to go home. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.